remotely.
Madam Acting Deputy President, I'd like to update the Senate on the developing COVID outbreak here in the Northern Territory. While other parts of Australia start to come out of the other end of this pandemic, hopefully, the Northern Territory is facing its biggest threat since the pandemic began. We've just heard news of 11 new cases here in the Northern Territory, bringing our numbers to over 50 cases. On Saturday, the remote bush community of Binjari, with a population of around just 190 people, recorded 9 new cases of the virus. We're now seeing the consequences of the Morrison Government's failure to roll out the vaccine in the Territory and provide appropriate information to vulnerable communities in the time that he had promised he would. As a result, misinformation is absolutely rampant on social media, and I condemn these dangerous lies that are taking place across social media. The vaccine is safe, and no one here in the Northern Territory has died from the vaccine. And I need to reiterate that. No one here in the Northern Territory has died from taking the vaccine. And it's important that our communities in particular are aware of it. In fact, the vaccine has saved many lives. I'm frustrated to also, Madam Acting Deputy President, with the failure of the Morrison Government in ensuring priority groups were sufficiently vaccinated here in the Northern Territory and elsewhere. More work needs to be done to combat those dangerous misinformation on vaccines. Indigenous people were meant to be a priority. We were supposed to be one of the first lot to be vaccinated, and here we are near Christmas with a major pandemic on our hands and largely First Nations people who are infected. But the Morrison Government failed in achieving their own target, and it must be said, it must be realised, Madam Acting Deputy President, that that failure leaves us where we are today. Yes, we should certainly celebrate achieving broad vaccination targets across Australia as a whole. The government should be ashamed that some of our most vulnerable communities here in the Territory have double dose vaccination rates as low as 20%. The government has dragged its heels in providing effective communication strategies to educate and encourage Indigenous people to protect themselves, their community and the wider Territory by getting the vaccine. The government took months to listen to community groups and provide funding to First Nations Media Australia in particular to produce and distribute culturally appropriate messaging in language. Unfortunately, for some, it is too late, as this vacuum has been filled with dangerous misinformation on vaccines, which are reinforced by some of the Prime Minister's own backbenchers. It's embarrassing to see coalition members turn their back on science, truth, and the life-saving work of our nurses and doctors. Already here today, we're at 41 degrees in the Northern Territory. We have health workers out there in heavy PPE gear to try to protect our most vulnerable. They are out there in the humidity, the top-end humidity of the wet season, and in 41 degrees. These people need our support, not our condemnation. So I'm incredibly grateful for the tireless work of our Territory healthcare staff who are bearing the brunt of this pandemic. Many nurses and doctors are working far away from their families. We've seen millions of people die from COVID overseas. We've seen hundreds of people die here in Australia, in Victoria and New South Wales. We do not want to see the same disaster unfold here in the Northern Territory.